I'm Dr Ian Strawford and I'm the Medical Director of Skin Excellence Clinics. PRP, what is it? How does it work? Why does it vary so much in price? What does it do anyway? So there are many questions I get asked about PRP. So hopefully in this video, I'm going to answer a lot of those questions that you all come to me with about PRP.
What is PRP?
So PRP is a medical treatment. PRP stands for platelet-rich plasma. So I'll explain what that means. So our blood, all human blood, all right, contains cells, red blood cells, white blood cells, and platelet cells. And the role of platelet cells is to do with repair and rejuvenation. So the whole role of these cells is that they carry messenger proteins. These are signaling mechanisms, okay? They're often called growth factors, and they tell cells what to do. And in the type of growth factors that are in platelet cells, they tell stem cells, which are cells that can be made into all sorts of different tissue, how to be, what to make, and how to repair. So when we're looking at the skin particularly, then we're asking those stem cells to make new skin cells, to make new collagen, to make new cells that produce collagen, to maybe influence other cells like pigment cells. So there are many uses of PRP in medicine today, but we're specifically using them in our clinic mainly for restorative or regenerative aesthetics. We're trying to reverse skin aging. We're trying to improve damaged skin. We're trying to improve the quality of the skin, maybe treating scarring. Those are often the ways that we're using PRP.
What can PRP be used for?
So at Skin Excellence Clinics, we're using PRP, and we have done for many years, specifically for improving the quality of the skin. So we may be treating sun damage, we may be treating age-related skin changes such as lines and wrinkles, loss of elasticity of the skin, improving the complexion of the skin and the tone of the skin. We may be treating scarring, specifically acne scarring, or even surgical scars, or even stretch marks and scars associated on the body from pregnancy and weight loss, what are called stretch marks. So PRP can be used in all sorts of scarring. We find PRP particularly good around the eyes. It can be used to improve dark circles and under eye hollows. And we use PRP in the hair, in part of our hair restoration. So PRP can have a direct effect on stimulating better and more improved growth of our hair, whether it's a thicker, better quality hair, or actually helping hair follicles grow, especially after and before transplantation of hair. So there are many uses. We use it for the O shot, for the P shot, and we're often treating other conditions of the body where there is skin disease with PRP.
What is the vampire facelift and facial?
The vampire term, or vampire facelift, vampire facial, was coined quite a few years ago by Kim Kardashian. And it was basically, she had a PRP treatment, and because it's taking blood and it's her blood, then obviously there was blood on her face and it looked like she'd been attacked by a vampire. So that's where this term came, the vampire facial, the vampire facelift. Actually, in our clinic, the vampire facelift, we define it. It's a treatment whereby we're using very high concentrations of PRP in conjunction with very small amounts of dermal fillers. And this is to accentuate the collagen stimulating potential of PRP by placing the PRP deeper down within a small amount of a dermal filler. As well as treating the skin in a facial way to improve the quality of the skin. So it has been dubbed the vampire facelift for that reason.
Can lichen sclerosis be treated with PRP?
There are many uses of PRP, and one of the most effective that I've come across is for quite a nasty skin condition called lichen sclerosis, which is an inflammatory autoimmune disease of the skin So it's associated with inflammation, which is pain, redness, and itching, followed by damage and scarring to the skin. It's a particularly distressing and disabling condition when lichen sclerosis affects the genitalia, especially in women. It can affect men, and so it can start to cause painful sex and intercourse due to the inflammation of the labia, the labia minora and majora, which is the bit of the outside part and the outer part of the vagina. And it can eventually lead to quite a lot of tissue destruction and scarring of the skin, making even urination impossible. So it's a horrible condition that up till now has had no medical treatment that's been effective. But there is good studies and good evidence that injections of PRP can reverse lichen sclerosis and cure it, and certainly maintain the health of the tissues in that area. So we do use it quite effectively in those patients with lichen sclerosis.
How many PRP treatments are needed?
So the number of PRP treatments really depends on what we're treating and the age of the patient and what we're trying to achieve. So in a younger patient where we're looking just for some skin rejuvenation and some benefits there, then perhaps 1 treatment, 2 treatments would be, we would see some very significant changes to the quality of the skin. In older patients, or if we're dealing with scarring or acne scarring, then we may need to have many more treatments to get some significant changes. When we're treating the hair, then normally, again, if we're treating men for male pattern baldness, then we would probably do 3 or 4 treatments quite close together, maybe a month or so apart, and then a maintenance treatment every 6 to 12 months. In women, the cause of hair loss is much more varied. It can be hormonal, it can be lots of other reasons, but women respond very well to PRP in the scalp, and again, usually 1 or 2 treatments, we start to see some significant changes to the quality of female hair. But it really depends on the condition we're treating as to the number of treatments, and we would discuss that with you at your consultation following a thorough examination and what we're trying to achieve with this treatment.
Is PRP safe?
PRP technically is a very safe treatment. It's autologous. By that we mean we are taking your blood, and it's only your blood that we're ever using. So there is no risk of rejection of those cells or that serum being injected back into yourself. And we use very safe, what are called closed systems for the separation of the platelet cells from the blood serum. So there is no risk of cross-contamination with anybody else's blood in the processing of your PRP. It's very natural. PRP itself has a lot of anti-infective and anti-inflammatory effects. So there is no, I've not seen any long-term or significant side effects associated with the treatment with PRP.
Is PRP treatment painful?
So PRP treatments can be painful. The injection of PRP can be quite uncomfortable and stinging at the time. So we'll often use topical anesthesia to make that more comfortable. But that mild discomfort that people can experience with PRP is usually transient. But it really depends on the area where we're treating. With regards to PRP in the scalp and on the face, we have an auto-injection mesotherapy gun, which fires a little tiny needle into the skin and passes a small droplet of PRP. And that's a very fast and efficient system, with making it actually virtually painless. So we do have ways of injecting PRP that can be pretty much painless.
Is there a recovery period after PRP?
So following a PRP treatment, there may be some redness of the skin. Depending on how we're injecting the PRP, there may be some localized bruising or swelling, but again, as with any injectable product, but it's usually minor if that does occur and self-limiting. We can use PRP in conjunction with what's called a dermapen or a microneedling device, where the device is firing little tiny needles into the skin, making a little puncture, and the PRP is then put onto the surface of the skin for it to absorb in. many uses of PRP. We can place the PRP on the surface of the skin after we've done a radiofrequency needling device treatment such as Morpheus 8 or even a Tixel treatment. So there are many ways of delivering a PRP treatment, and they're all very, very safe. But it really depends on what we're treating and how we're treating as to which system of delivery that we're going to use.
Why is PRP more expensive at certain clinics?
The issue with PRP is, and there are many places, many clinics, many even non-professionals, non-medics offering PRP, but it's not all the same. Not all PRP is the same. And there are different variables when we're dealing with PRP. So the quality of your blood is one factor. And we know that the number of platelet cells may deteriorate with age. They can actually fluctuate from day to day, and they certainly can deteriorate if you've had a recent illness, like a viral illness. You may have low levels of platelet cells. So there are factors within the body that influence the quality of the PRP we're getting. Secondly, how we take your blood is really important, in as least traumatic way as possible, and just using a regular needle and syringe may damage the platelet cells. And that's often what I see, that people are not getting PRP, even though somebody's taking their blood. You have a special way of taking the blood so we can not damage the platelet cells. And then the processing of the blood is not a matter of just centrifuging or putting the tube of blood into a machine that spins and separating the cells. That does not create PRP. So there are systems that will very carefully isolate the platelet cells and concentrate them within the serum. And that's why it's called platelet-rich plasma. Okay, so that's a higher concentration of platelet cells. I have two of the state-of-the-art systems. One is called the Magellan True PRP, which will give me a guaranteed number of concentration of platelet cells from any volume of blood. And the other, which is a slightly more simpler system, is the Silenis system, whereby we also concentrate the platelet cells in a different way within the tube. Those are both proven technologies, and that's what's really important. Now, those technologies are more expensive, and that is one influencing factor to why a PRP treatment may cost more at our clinics, depending on what we're treating, and the volume of blood will depend on which of those systems we use. The second is actually, as a medically regulated, CQC regulated clinic, we invest a lot in both the facilities, the safety, our staff, ourselves, our education, keeping up the forefront of things. And, that's why we are seen as a centre of excellence. And for quality and excellence, you're always going to be paying more.